Imbalance in T hyper 17 cells and targeted therapy. Definition SIN syndrome, which is characterized by severe dermatitis, multiple allergies, and metabolic wasting, is as congenital skin disease caused by mutation in 10 genes encoding either demolishing or demolishing.
Mechanism of action of cell-based therapies. Stem cells are self-renewing undifferentiated cells that can have the potential to differentiate into any organ-specific cell, depending on their origin. They can be characterized as either embryonic or somatic or adult stem cells. They differ in their potency and differentiation capacity depending on the tissue of origin. Thus far, hematopoietic stem cells, or HSCs, and mesenchymal stem cells, or MSCs, have emerged as promising cell-based therapies for severe refractory IBD cases. HSCs can be isolated from the bone marrow, umbilical cord blood, or more commonly peripheral blood of an individual, and eventually transplanted back to the same individual, autologous. These stem cells can also be received from a matched donor, allogenic, for potential cell-based therapy. HSCs are progenitors of both the myeloid lineage, monocytes, erythrocytes, macrophages, neutrophils, and dendritic cells, and the lymphoid lineage, T cells, B cells, and natural killer cells, and are capable of migrating to damaged tissue and differentiate into immunomodulatory cells in order to restore normal gut mucosal barrier function and reduce inflammation. Like HSCs, MSCs are also multipotent self-renewing cells that are capable of differentiating into several types of cells and are present in various tissues of the body. MSCs can be isolated for clinical application from bone marrow, umbilical cord blood and tissue, Wharton's jelly, or adipose tissue. MSCs derived from adipose tissue are easily extracted in large quantities.
Application in nursing. Available treatments targeting 17 cells include biologic drugs that are currently licensed for cirrhosis therapy, such as ustekinumab and sukinumab. Ustekinumab was recently evaluated in 2 patents in DSP mutants, but we had obtained little cutaneous improvement in another patent with SIN syndrome who has DSG mutations.
Immunotherapy is an exciting area of cancer research that is changing the way we think about cancer treatment. Immunotherapy works by using the body's immune system to fight cancer. The immune system is a complex network of organs, tissues, and cells, and the substances they make. Immunotherapy uses different ways to boost the immune system to do a better job of killing cancer cells. This video describes one type of immunotherapy called T-cell transfer therapy that is used to treat cancer. T cells are a type of immune cell and are powerful weapons the immune system uses to fight cancer. For T-cell transfer therapy, T cells are taken from a patient and changed in the laboratory to make them better able to target the patient's cancer cells and kill them. Millions of copies of these specially changed T cells are then grown in the laboratory and given back to the patient to fight the cancer. T-cell transfer therapy is an effective way to treat some types of cancer, but it doesn't work for every patient and can cause serious side effects. To learn more about immunotherapy, visit cancer.gov/immunotherapy or call 1-800-4-CANCER. U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4-CANCER. Artwork and animation by Therese Winslow, LLC, and Devon Medical Art, LLC. Produced October 2000.
Pros and cons. Extract early mechanical aspiration syndrome as is positive prognosis and does not have to present future complications. Chemical aspiration pneumonia, brain damage due to lack of oxygen, short necks, ox breath lasting several days, pulmonary atelectasis, versus pulmonary hypertension of state newborn.
Neuroblastoma is a type of cancer that affects young children. Current therapies include surgery, chemotherapy, radiotherapy, and stem cell transplants. However, when the cancer cannot be controlled by these treatments, other therapies are required. GD2 CAR T-cell immunotherapy uses engineered T-cells to fight cancer. These T-cells have chimeric antigen receptor molecules, also known as CARs, added to their cell surface. The GD2 CAR binds to GD2 molecules on the surface of neuroblastoma cells and triggers the T-cell to kill the cancer cells. CAR T-cell therapy has been effective in fighting blood cancers, but until now, not strong enough to treat solid tumors like neuroblastomas. This is because there aren't any growth factors in a tumor to stimulate the immune system, which prevents sustained activity of the tumor-killing CAR T-cells. Now, researchers at Texas Children's Hospital have created a new molecule called C7R to selectively boost GD2 CAR T-cells with growth factor signaling and give them the endurance they need to fully eradicate neuroblastoma tumor cells. As a result, these C7R enhanced GD2 CAR T-cells continue eliminating tumor cells long after normal GD2 CAR T-cells have stopped working, so they can tackle the tough tumors like neuroblastoma. Dr. Bilal Omer and Dr. Cleo Rooney are now leading the clinical team at Texas Children's Hospital to bring this novel immunotherapy to neuroblastoma patients in a new clinical trial. The clinical trial to use C7R enhanced GD2 CAR T-cells is now open, and this novel immunotherapy is now being offered to neuroblastoma patients at Texas Children's Hospital. If your child has neuroblastoma that has stopped responding to therapy, this clinical
Isigo applied to Ecuador. Between 9 and 15% of the participants are complete with presence of meconium in ammonia, fluid and historical, and 5 to 11% of those cases developed SAN. This figure has dropped in developed countries to percentage between 16 and 39%.
Your body's own immune cells are some of the greatest weapons you have against cancer. Adoptive cell therapy is a type of immunotherapy that uses your own cells. In one approach, cancer-fighting immune cells, called T cells, are removed from the patient grown in the lab and then given back to the patient in vastly increased numbers. As many as 100 billion cells may be given this way. Once inside the body, this army of T cells goes to work finding and attacking the cancer. Some types of cancer, such as advanced melanoma, have been cured with this form of immunotherapy. A related approach is called CAR T-cell therapy. CAR stands for chimeric antigen receptor. Chimeric means two different things joined together. In this case, an immune molecule called an antibody is joined to a T-cell receptor. CARs turn your ordinary T cells into an elite fighting force that can seek out and destroy cancer. Although the total number of people treated with CAR T cells is small, the results are impressive. In some studies, 90% of leukemia patients treated this way have had complete responses. This approach is not yet FDA approved, but it is being actively pursued in clinical trials, and the technology is advancing rapidly. Created by the Cancer Research Institute, the leader in immunotherapy. To learn more about immunotherapy and about clinical trials, visit our community for patients and caregivers at theanswertocancer.org.
Conclusion. The major effect of sex number in our patients' quality of life servers interleukin in 17A as a new target as true patients. Why serious sex disorder? Three world also this group of cells that act but collaborations and regulatory. Since its addiction to tar could surprise funditants, the world also coordinates the first stage of viral infection directly as well in indirectly inducing big secretary TGF. The differences of TH17.
This week's Ask Dr. Dury comes from a gentleman who wants to know about CAR T-cell therapies. His question is, can CAR T-cell therapies be used earlier in the disease? And the answer to this is yes. This gentleman is obviously very well informed and knows about CAR T-cell therapies and the fact that currently they are typically used in patients with relapsing myeloma, often very advanced disease. Now, CAR T-cell therapies are engineered T-cells which are taken from the patient and then engineered in the lab to target the myeloma. Right now, the most successful target is BCMA, B-cell maturation antigen. And so there are several products, several types of CAR T-cells that are in trials currently. And as this gentleman points out, mostly in patients with very advanced disease. The problem with moving those therapies into an earlier disease situation is the possibility of side effects. And the main concern that has emerged is something called cytokine release syndrome, CRS. And this has been a concern, particularly with some products and particularly in efforts to use much higher doses of the cells. However, there are now multiple protocols where this has been taken into account using a good dosage of cells and with some modified products, such that this CRS is much less of a concern. And so the important thing is that the benefit, the efficacy has been retained. And so I think what caught the attention of this particular gentleman was the fact that in advanced...
Thank you.